I'm Rachel. I'm going to be your nurse practitioner today. Can I have your name and date of birth?
Yep, Dustin Martsoff, September 6th, 1997.
Okay. And what are you here for today?
Just a normal checkup.
Okay. Any health concerns at all?
No.
Right now, you just wanted to kind
Just-
of get looked at?
Yep.
Okay. When's the last time you've had a healthcare visit?
I would say probably around 2 years ago.
Okay. Was that just a checkup as well, or was that for any issues?
Yeah, just a checkup.
Any allergies at all?
As far as I'm aware of is penicillin.
Okay. Do you know what your reaction is to that?
I'm not sure.
Okay. Any food or like supplement allergies that you
No.
know of? Okay. Your overall health, if you could give it a score, would you say bad, fair, good?
I think pretty good.
Have you had any recent illnesses that you needed to see a provider for or been hospitalized for?
Nope.
Alright, I'm going to move on to your medical and surgical history. So any medical history such as like asthma, hypertension, diabetes, thyroid problems, high lipid levels,
No.
nothing like that?
No, just a hernia.
Okay. Do you know what type of hernia?
Yep, inguinal.
And have you seen a provider for that?
Yep.
Okay. Any plan for it or just keeping an eye on it?
Just really keep an eye on it. They said if it like hurts or anything like that, just get it checked out.
Have you had any surgeries at all?
Tonsils and adenoids.
Okay. Do you know when that was?
I would say around like 6, 7 years old.
Okay. Are all of your vaccines up to date?
Yep.
Tdap, flu, COVID, hepatitis, all of those?
Yep.
Have you had any exposure to any of those?
No.
Do you take any medications on a daily basis?
No.
Any supplements, vitamins?
I try to take some vitamins, and then I'll take just protein.
Okay. Alright, I'm gonna move on to your family history. Mother, is she alive and well?
Yep.
How old is she?
55.
And does she have any medical problems that you know of?
Not that I'm aware of.
Okay. No like hospitalizations or anything recently?
No.
What about your dad?
Gonna be turning 51.
Okay. And does he have any health problems?
No, not that I'm aware of.
Okay. Grandparents. Do you have any living?
Mm-hmm. Yeah, 2 grandmothers and a grandpa. So.
Okay. Are they fairly healthy other than just age-related problems?
Yeah, pretty much.
Okay.
Just mostly back pains.
Okay. The grandfather that is passed, do you know how he passed?
I believe through kidney issues.
Kidney disease. Okay. Alright, I'm gonna move on to your personal history. What is your home life like? Do you live in a house, apartment?
I live in a house with my wife.
Okay. Any animals?
Mm-hmm. Yeah, we have a pup and a cat.
Education level. Do you have college education, high school?
Mm-hmm. College.
Okay. What is your occupation?
Registered nurse.
Do you have any religious preferences?
Christian.
Okay. Does that affect your care at all?
No.
Any alcohol use?
I would say more social.
Okay. Are you able to give it a number about how often?
Maybe once a month.
Okay. Any smoking, drug use? Any former smoking or former drug use?
Nope.
All right. Eating habits. Are they
I think fairly well.
okay? Do you try and just kind of maintain a good diet? Are you dieting? Any?
Kind of mix. I would like to eat a little bit better.
Okay. What about your caffeine intake?
Depends on the day. If I'm working out, I'll take pre-workout, but most days I drink just a cup of coffee.
A cup of coffee a day. How often do you exercise?
I would say between like 3 to 4 times a week.
Okay. What kind of exercises do you do?
Mainly weightlifting.
Weightlifting, okay. With the hernia, does the weightlifting like cause any problems?
No, not that I've noticed.
Okay. All right, we're gonna move on to body system. So I'm just kind of go down the list and ask you a whole bunch of questions.
Okay.
I know you said you're just here for a well visit, haven't had any recent illnesses or anything, but no complaints of like fevers, chills, coughs, fatigue.
No.
Nothing like that. What about your vision? Do you have any blurred vision, seeing spots, seeing flashes of light?
No, I mean I wear contacts, so without them, it's pretty blurry.
Okay. Do you receive regular eye exams?
Mhm.
Okay. When is the last time you saw an eye doctor? Do you know?
Last year.
And you stay up to date on your exams?
Yep.
Okay. Any ear, eye, nose, throat pain?
No.
Mouth pain? Nothing?
No.
Do you experience any headaches at all?
No. I mean I've had them in the past, like migraines, but.
Okay. Do you have any sensitivity to bright lights, loud noises?
No.
Nothing like that. No, like ringing of the ears, anything
No.
abnormal? Do you have any like runny nose, nasal discharge, swollen lymph nodes that are either painful or not painful?
No.
All right. Lung-wise, any shortness of breath, coughing, wheezing, feeling like there's anything like stuck in your throat at all?
No.
No. Do you ever have any like chest pain or chest tightness?
No.
Does that change at all when you're working out?
No.
Okay. I know you didn't really give me any like family history of respiratory diseases, but no respiratory diseases of yourself, right?
No.
All right. Heart-wise, any heart issues that you're aware of? Palpitations, chest pain, chest tightness? Ever feel like there's like a heavy weight on your chest?
No.
Any swelling, like abnormal swelling in your lower extremities, facial, anything?
No.
Okay.
Yeah, they're all pretty good.
Okay. Abdominal issues, any stomach pain? I know we talked about the hernia. What are your bowel habits like? Pretty normal?
Pretty normal.
Okay, no like excessive constipation, excessive diarrhea?
No.
Okay.
No, at least probably once a day.
No recent like vomiting, nausea, diarrhea, anything like that?
Mm-mm.
Urinary, any urinary problems? Any like discharges, foul smelling urine, sore,
No.
like nothing like that?
No.
Do you often have to get up at night to go to the bathroom?
No. I'm pretty good.
Do you feel like you stay well hydrated?
Most days.
Okay.
Like if I'm working, I feel like I need to drink more.
Okay.
Especially like whenever I come home, but other than that.
Okay. Any skin issues, any rashes, any moles that are new or changing, getting bigger, changing in color, changing in border?
No. I mean, the only thing is a skin tag like on the side here.
Okay. Obviously we all sweat, but any like extremely foul smelling odor? Nothing
No.
out of the ordinary?
No.
All right. Muscles and bones. Any muscle pain, bone pain, joint pain?
No, I mean, maybe like after working out.
Okay.
But
Just like
to be
soreness?
expected.
Okay. Ever when you're working out, do you feel like your muscles are going to give out?
On a good lifting day.
Have you ever had any muscle or bone injuries in the past?
Yeah, my right elbow fractured my growth plate.
Okay. Has that ever caused you any issues?
No,
Was that casted at the time?
no, just put in a sling.
All right, neurologically, any headaches, migraines, dizziness? Nothing like
Yep, I had migraines in the past,
that? Okay.
but
Are you able to tell me the last time you had one?
maybe 3 years ago, I'd say, like in college.
Okay. Did you do anything to treat them, or just
Just went to sleep.
like symptomatic
Yeah,
treatment? Okay.
Just so.
Okay. Are you forgetful at all? Any memory issues?
I don't think so.
Okay.
My wife would probably say otherwise, but
No history of like seizures or
no.
no like numbness, tingling of your fingers, hands, feet.
No.
All right, I'm gonna move on to like bleeding issues. Have you ever had any excessive bleeding problems or excessive clotting problems?
No, I mean, I used to get nosebleeds
Okay.
pretty frequent.
Okay. Did the nosebleeds happen more frequent in a certain time of year?
Yeah, more or less like winter time.
Okay. But you were always able to control them?
Yeah, I mean, there were some blood clots that came out, but
Okay. Do you like bruise easily, or do you think that's pretty normal?
no, yeah, that's pretty normal.
Okay. Have you ever been told that you're anemic at all?
No,
Any major stressors in your life?
no,
Okay. Do you have a good support system, do you think?
yeah,
Okay. Any anxiety or depression?
no,
Have you ever had any suicidal thoughts or plans or feelings?
no,
Okay. Have you ever had any ideas of self-harm?
no.
And how are your sleep patterns?
I think pretty good.
Okay.
When I can sleep, I can sleep.
Do you have any trouble like falling asleep, staying asleep, trouble waking up?
No.
Oh, okay. No problems with like falling asleep when you don't want to, like while driving or.
I mean, I get kind of tired like driving at night, but I think that's normal.
Okay. Right. Well, I think that's pretty much all. We'll get you checked out and then see what's going on. It was nice to meet you.
Thank you.